And first, I want to thank JP and Mazen and everyone here for inviting me to talk to a big group of hepatologists and other types of providers. And here I am, a sole patient. So I'm very, very excited to be here. Here are my disclaimers. And first, let's understand the barriers to effective diagnosis. This is going to be the first and only slide I probably read. Understanding the multifaceted barriers, including stigma, cultural perceptions, and systemic challenges, is essential for hepatologists to enhance patient engagement and improve outcomes. So I ask our community, as Jessica mentioned, I'm the founder of Sober Livers, and we help patients with social support who have alcohol-associated liver disease. We have a pretty active Facebook group, so I ask a question about what they perceive their barriers to getting a diagnosis was. And as you can see here, flying under the radar was 18%, and stigma came in, oh, I'm sorry, I can't read my notes over here. Stigma came in at 18% and then 13%, sorry, but 24% of people said that they weren't ready to stop drinking. So my question to that is why? Why were they not ready to stop drinking? Well, we heard yesterday a lot about the advertisements. We also know that people's jobs require them flying around and entertaining people. We know that stress is also a factor and stigma is a factor. But this is one that really gets my goat when you talk about advertisements. Let's see if I can play it here. I don't know if it'll make the sound. Hopefully you guys will get the point. Here they, oh, there it is.
We're playing for ultras. Brace you for an ultra.
Put an ultra on it.
Don't forget, there's ultras on the line.
Woo. I didn't.
Okay, that ad obviously is showing, hey, you know what? If you work out, you deserve to have a beer afterward. And I don't know what happened to having a water after working out. I don't know. And here's a couple other advertisements that I've seen recently, which this t-shirt drives me crazy. Shut up, your liver is fine. I mean, what is this telling young women? And then this water bottle is saying it may be water, but it also may be vodka. Don't know what's up with that. So I'm going to be really vulnerable today with you, and I want to share some stories about myself, and then I'll also bring in some from our community. But this is my grandmother's 90th birthday. It was 2012 in St. Louis. I was living in her home. She had moved to assisted living community, and this home was where my dad grew up. They let me come there after being stalked across 3 different states from an abusive boyfriend. And at this time, I had also stayed at 3 different domestic violence centers. And so what they didn't know, as I'm smiling here, is what was going on underneath me was this. Why? Because he had found me again, and he had gotten to my grandparents' home. And he told me if I told anyone that he would hurt or kill my dog. Now, this threat was just overwhelming. So what I did, because I was pretty steadily into addiction from the abuse, is I would excuse myself to go to the bathroom. I would go to the bar, order a glass of wine, pound that glass of wine, maybe even 2 glasses of wine in the bathroom before returning, so I could not be shaking like this, not from withdrawals, but because I was so scared of the consequences if I were to let them know. So this is the dog that he was talking about. This is my hero, Atlas. He stayed with me through a decade of intimate partner violence with 2 different partners. I call them B1 and B2. They were, both of their names begin with Barry, and Barry, there's one of his names. both of their names begin with B, and they were both definitely bombers in my life. This picture was actually taken in California after my mom picked me up after this B2 had made me drive with him back to South Dakota and North Dakota. after that celebration that you just saw. So my mom came and picked me up from the DV Center. She drove me back to California. It was not a conducive situation. My stepfather had a severe alcohol use disorder. He died in 2019 from alcohol-associated cirrhosis, and I was already disassociating from PTSD. So I was really a mess. So this is going back then, before that party, before all this happened. This is in 2008, and this was B1, my first like huge abuser, I guess I would call him, the physical, psychological, and everything. And the little girl there, she was not my biological daughter, but I raised her from the time she was 18 months until she was 6. She was one of the main reasons I did not leave that relationship. I also worked for his aerospace company, a small company that I grew from 1.2 million to like 7 million in the time I was there, and we got NASA contracts. I loved aerospace. In fact, I loved it so much that people were asking me, "Are you an aerospace engineer?" And I would tell them, "No, but I can BS aerospace really well." But we used a lot of acronyms there, and I know in hepatology there are many, many acronyms, so I am working on earning my BS in hepatology as well. So here's the issue that we were talking, and Doug, thank you for sharing about opportunities for intervention. There were 12 different times in my life where intervention could have happened. In 2006, my PCP said my eyes looked a little yellow. In 2007, my sleep apnea surgery that I had, I screamed out, "I'm an alcoholic," before I went under anesthesia because I was so scared that I wouldn't wake up because I knew how much I drank. In 2009, my parents, after that horrible breakup and me drinking a lot, told me that I needed to go to a 30-day clinic. I did. It was an inpatient clinic, and when I left, the owner said, "You can have 50% off of your next visit." And I said, "What would make you think I would come back here?" And he said, "You're an alcoholic. Alcoholics always come back." And then I mentioned the DV centers that I stayed in, but they had a no alcohol policy. So for someone with an addiction, it was very, very difficult to stay there. And then in 2013, I actually put myself into a voluntary 72-hour hold. And that was because of what was happening inside the household in California. I received a physical health evaluation, and they found fatty liver, but they did not refer me to a hepatologist. Instead, they referred me to mental health, in which I was told that you can't have PTSD, you weren't in the military. So that led to 2018 at 46, when my liver failed. I had severe alcohol-induced hepatitis and decompensated cirrhosis. So what I was wearing back there in that party was a mask. And these are the barriers that I want to talk about today: mental health, awareness, stigma, and knowledge gap. All of these create a framework. I told you I was going to use an acronym for MASK, which induces a lot of fear. And fear is so overwhelming when you're dealing with an addiction. So mental health is really a lot about cause and consequence. So the question becomes, the chicken or the egg? Did the AUD cause the mental health? Did the ALD cause the mental health? Did the AUD cause the ALD, which caused the mental health? I mean, we could go rounds and rounds with this. And my belief is that it is all of these. And what I think is happening is AUD and ALD just fuels the fire of mental health. And when you have that fire, it's much like the forest fires. It's really hard to put out. Both your mind and your physical body have been greatly affected. So statistics alert. Okay, I'm about to show statistics up on these screens. I'm right here in the middle, so I'm going to be doing the talking, and I'm not going to be talking about what's on these screens. So look at that quickly, and then you can look back to me for the stories I'm going to share about this. So as I mentioned, after I left that 72-hour facility, I went to the mental health place or the mental health center where I was told about not having PTSD. They put me in a group, and in the group, I had a woman who was part of that group telling me that I was too well to be there. And once again, I was wearing a mask that was hiding all of these things underneath. It was hiding the fear. And then here we have awareness. Okay, I knew that drinking was bad for my health, but I also knew that I had severe mental health challenges. And I told myself a lie. I told myself, if I could just get through these mental health issues, I will stop drinking. And what do you know? I got safe in 2013, and 5 years later, my liver failed. So my plan of regeneration did not work. I think that this is in the heads of a lot of people who are drinking today, because it gets in your head that your liver can regenerate. I think that this is a really bad message. I think it should be followed with, if you don't put any toxins in your body, it will get sluggish if you do. If you stop the toxins entirely, it may come back, but when that could happen is a crapshoot because you don't know what your genetics are telling you. There's just so many pieces to this pie that it's really hard to know. And then also with awareness, one of our group members, she told me that she really only socially drank, and she never knew that genetics could possibly be an issue, saying that her parents were both she called them alcoholics, have alcohol use disorder, and then she said that she drank socially on the weekend, and she's like, oh my gosh, I should have my genetics tested. So I've only got one slide up here about stigma, and I can't read my notes all the way over here, so I'm just going to tell you that I think that this is probably one of the most important barriers that we need to try to help with, dismantle, and take care of. The reason for this is because I respect all of you and I love all of you. I'm going to say this first because yesterday I was sitting there and I was hashtagging or just putting lines every time I heard alcoholic liver disease or alcoholic cirrhosis or alcoholic hepatitis. Now, a few of the people who talked never used those terms, but it is still in the vernacular. It is still being said. And even amongst colleagues, because we all know that the ICD codes haven't changed, which need to change, even amongst colleagues, though, if we start talking the talk, it's not going to slip up when you're speaking the language to the patients. And so I do think that this is really, really important. With me, for stigma, I mean, there were so many barriers that kept me from getting care. And even after I did, when I made it to the gym and my legs were too big and fat for me to actually put on shoes, I told everyone it was kidney disease that were causing it because I did not want to have that stigma attached to me. And when I was talking to our advisors the other day, one of our new advisors, he lives in Massachusetts, and his father was a very well-known doctor there. And he was talking to his dad about liver disease, and his dad said, well, you know, a lot of people die from liver disease, but in the obituaries, you won't see it as their cause of death, unless the family specifically says, please put liver disease on there, you're not gonna see it. So we really don't know how we can share how susceptible this disease is if we're just not even sharing the information in the obituaries. And finally, knowledge gap. As you can see in these statistics, we do have a severe knowledge gap. I think primary care is by far one of the biggest knowledge gaps that we have, and we really need to talk about solutions, whether it's podcasts that share information. I don't know where Roger is, around here somewhere. There he is. And podcasts like Roger's, other podcasts that PAs listen to, where are they getting their information, and how do we get different types of testing done besides just the outdated testing of liver enzyme tests? I don't think I had any other NIT when I was at my PCP level, and I know for sure that my partner, who is 56 years old, overweight, and drinks heavily, has not had a scan, nor has he had any of these other tests done. So I do think that there's a huge gap. There's also a huge gap in healthcare as far as 30% of young patients feel dismissed by professionals. Well, I can tell you that that's true, because I can tell you that when I was talking to one of our other advisors, she told me, she's like, I kept on going to the PCP and I kept on, trying to get them to help me, and they just told me that I probably didn't have a problem, I was too young. And then my story is I was actually hospitalized for pyelonephritis. And I told them that I drank heavily. I didn't mention the 30-day treatment center. Oh no, didn't want that stigma. But I did say I just got out of an abusive relationship. I drank a lot during that abusive relationship, and because they said that I had high liver enzymes. And they're like, oh, no, you're too young. You're too young to have liver disease. Completely dismissive of where I was in the process. And then women, as most of you know, the levels of women getting hepatitis and getting severe alcohol-induced hepatitis and getting liver cirrhosis have been on the rise steadily and sharply for years now. But at the same time, when you're at the PCP level, many times they don't suspect women as having an alcohol issue. And I will tell you, we wear masks. We're really good at hiding it because, like for me, if my PCP had done a PEth test, which I highly recommend, and I really like the idea of PEth testing, then she would have known that I had a problem, because I'm sure my PEth test would have been off the charts. However, I did not go back to her for a year. Why did I not follow up with her? Because I had an abusive partner at home, and the last thing I needed to do was tell him that I was an alcoholic. I don't know what would have happened to me at that point. He may have kept his daughter from me. He may have abused me more. So we need to reduce that fear and then apply certain strategies like motivational interviewing, trauma-informed care. All of this is crucially important. And then our young adults, wow, we're really doing young adults a disservice right now because we are not screening the way that we should for liver disease. And I think that every person that walks through the door needs to be screened for liver disease and alcohol use disorder. And as I said, it's very hard to uncover, and this is why I will repeat motivational interviewing, spending some time with your patients. And I know once they get to your level, many times it's not too late, but many times they're so far along in the process they already have cirrhosis, so that your best bet is for either transplant or recompensation. So the MASLD recap is mental health is co-occurring mental health disorders such as depression, anxiety, and PTSD can obscure symptoms of ALD, hinder patient disclosure of drinking behaviors, and reduce healthcare engagement, delaying diagnosis and treatment. Awareness barriers, low public and provider awareness of alcohol's role in liver disease leads to missed and early diagnosis opportunities. And stigma, I'm going to stop there for 1 second because I wanted to pose a thought question in this recap. This was brought up during one of our liver forum groups that I'm part of. And I believe it was a hepatologist that said, okay, let's talk about when, let's just pretend that we just saw two patients. We saw one with MASH and one with cirrhosis from alcohol. And then we went out to lunch. We go out to lunch and we see the person with ALD sitting at the bar having a glass of wine. And we see our other patient with MASLD sitting at a table and just gorging on a hamburger and French fries and milkshakes. Okay, who are you gonna think, oh my gosh, oh my gosh, oh my gosh. Okay, nobody needs to admit that it's probably the person at the bar, but as most of you know, that is an implicit bias that most doctors do still have. And then knowledge gaps. Many clinicians lack up-to-date knowledge of ALD screening, early detection, and non-invasive diagnostic tools. We talked a lot about that today, so I'm very happy for the information that's already been shared on this, and I'm really hoping that we can work towards a solution regarding these knowledge gaps. And I am also going to make a plug for the ALD Ally Conference. It's going to be held coming up April 4th. I didn't talk a lot about patient preferences today, and I kind of did that on purpose because I didn't want to repeat a really important speech I'll be giving to patients, or to talk to you guys about what are the outcomes and what is most important to patients. And so I didn't talk about harm reduction today, which I think is a very interesting concept that we need to explore, especially with the new drugs that are on the horizon. And I also didn't discuss those new drugs, which I'm also extremely excited about. And last but not least, I have to plug my program. And as I mentioned, we're part of the Fatty Liver Foundation, but Sober Livers has what's called the HOPE program, and it means healing ourselves with peers and education. And just last night, I wasn't there. It was my first meeting I didn't attend, but we did an Ask the Pharmacist last night, and which is when we had one of our Whole Health Advisory Council members, which we have several of them here today, a pharmacist that was a transplant or solid organ transplant pharmacist, answer questions from patients regarding their medications, because people are always curious. We also have social support services and meetings every day. We have a buddy system, and as you saw earlier, a vibrant Facebook group. However, that QR code right there, to sustain these wonderful programs, we are always looking for donations. And so if you know someone that knows someone that knows someone, just pass the information along, because we could use all the help we could get. And here are some clinical takeaways. I'm out of time, so I'm not going to go through these, but we basically covered most of these during the MASC recap. And finally, I just want to say thank you again for letting me be here, be vulnerable, because vulnerability, I know now, is a strength. And as was mentioned earlier, what's said in Vegas stays in Vegas. So I appreciate your time today. And I have one other thing, because knowing I was going to be around a bunch of hepatologists, I asked ChatGPT to give me some jokes, some hepatology jokes. Don't do that. Don't do that. And nothing comes out good. So I tasked myself and my partner, and I won't share my partner's one he came up with, which was really great. If you want to know about it, ask me afterward. But my joke to you is this, since we are in Vegas. What is the dice you don't want to roll when you're playing craps? Anyone? John dice. So with that said, I brought a bunch of these flyers today, so anybody can pick them up. I'd love these to go to your patients, and if you have questions about our program, please seek me out. And thank you for your time, and I look forward to talking to a lot of you while I'm here. Bye-bye.
Thank you, Ms. Jones. That was a great talk. We promise you will do better with the terminology. Thank you for sharing your stories.